So shall we start?
Yep.
Okay, sir. Mental health is not a destination, but a process. Not until we are lost do we begin to understand ourselves. We welcome you all to this INGENIUM webinar on the most needed topic of the hour, stress management for medical students, presented by Dr. T.V. Asokan, sir, Professor and HOD of Department of Psychiatry, Sri Muthukumaran Medical College and Hospital and Research Institute. I now take the privilege of introducing Dr. T.V. Asokan, sir. Sir has formerly worked as professor and HOD of Department of Psychiatry at Stanley Medical College and NSRM Medical College. Sir has held various prestigious positions, including Honorary General Secretary, Indian Psychiatric Society, Tamil Nadu and South India, past President of Asian Federation of Psychiatric Association, life member of World Psychiatric Association. Sir has 32 years of experience in teaching and has conducted several psychiatric quizzes at regional and national level. Sir has presented and published papers at international and national conferences. Sir has authored several psychiatric books and has participated in several debates and discussions on sex education and mental health in TV channels. I now take the opportunity to welcome Dr. T.V. Asokan, sir, to enlighten us. Thank you, sir.
Thank you very much. At the very outset, let me sincerely thank Professor Sudhagar, psychiatrist, and the organizing team of Asokan and the students of Chengalpet Medical College for giving me this opportunity to speak a few words on stress management for medical students. Bertrand Russell was asked to define a human being. He said, man is a compilation of thought. The 15th century philosopher René Descartes came with a beautiful aphorism, cogito ergo sum. I think, therefore I am. With my thought process, I'm able to really retrieve the incident and event happening that really occurred long time back. With my thought process, I'm able to anticipate, fantasize the futuristic issues. And it is with my thought process, I'm able to be in tandem with the present events. So ultimately, to discuss, analyze, decipher a human being, one has to really focus on his thought process. Because thoughts become words, words become actions, actions become behavior, and behavior becomes destiny. It is a thought that is really, modulating or moderating the intensity of a conflict or a problem or a stress. What is stress? When you get up in the morning and look at the mirror, what you exactly see is an image. This answer is relatively right. But little bit outside the box thinking would make you to go for another answer. You are seeing your impression about your image. Because the perception of A about his image, A, that is different by another perception by B about A's image. When you look at the mirror, you go with some kind of an expectation. Kannadi munadi ellarume Kamala Hassan's Nayanthara. But the reality is little different. How far there is an incongruous nature existing between the expectation and the fantasy that decides our conflict or problem. A problem or a stress or a conflict is the discrepancy between what is happening and what should be happening. Life without stress is death. We need to have some kind of a stress. We need to have little bit anxiety before the exam, then only we'll prepare for the exam. Even that anxiety or that stressful situation has to be present in a measurable level. But unfortunately, if it crosses the pathological level, that will ruin the performance, and that's what Yarkis, Dots, and last states. If you sincerely ask me what is the best teacher, it is the last mistake we committed, or it is the last failure we experienced, because we learn from our mistakes. We improvise ourselves from our failures. Stressless life is the dream of an angel. But unfortunately, only 2 people are virtually free from stressful issues. That a fool is not in a position to know about the nature of the consequences of his behavior. And the man who surpassed himself to consider the positive and negative consequences of his behavior, only these two people are virtually free from stressful issues. Even Mahatmas are not an exception. You need to have a little bit stress, but unfortunately, see that it is not crossing the pathological level. Most of the medical students, either they are in adolescence or early adulthood. Adolescence is a period of transition. It is a period of perceiving the changes in the physical system, psychological makeup, and the social perspective. Who am I? What I'm going to do? What about my academic occupational pursuits? These are all the questions occupying his cognitive realm, and he has to find out the answers on his own. If the answers are acceptable, compatible, conducive, then there is an establishment of proper identity of personality. But unfortunately, if it is a little bit incongruous, based on the cultural milieu to which he is exposed, based on the biological constitution, based on the parental rearing practice, based on the other cultural aspects, either goes for a minor neurotic spell or a major psychotic spectrum or even a personality deviation. Physical changes are due to hormones. Girls during adolescence, they start becoming extremely conscious about their appearance. Change of voice may be really producing some kind of anxiety. Acne is a major problem in the body image disturbance. Muscle gain sometimes leads to excessive weight. And sometimes girls may be worrying about regular or irregular periods. There are a lot of emotional changes. The adolescent often confused about their role. They're torn between their responsibilities and desires. They're extremely emotional. Mood swings are common. Sometimes they go for an escalated self-esteem or a low self-esteem. And it is not uncommon to see an adolescent harboring sexual ideas, but unfortunately that sexual ideas may result in guilt feelings. The behavioral changes, impulsive behavior. It is a time they question the answers given by the parents, and that may look like an argumentative nature, or they may look like a stubborn individual. The changes in the brain, I think, that may result in moody behavior. Physical confrontations are due to raging level of hormones, and the newly found independence would result in risk-taking behavior. I think I can really try this. I can experiment this. I can look after myself. I can come out of it, even if it is something bad or something risky. They may be imbibing the way they dresses, the way I think people know the peer group, the slang they use, the dress they use, everything is imbibed by the adolescents. And mingling with the problematic adolescents, that's also another problem. And lying is also seen in this period. Substance abuse, for the fun of it, for the heck of it, for the sake of seeking pleasure, they may be experimenting a substance called nicotine or alcohol. You know pretty well after some time, each and every drug has got some endo period. If somebody is not smoking continuously for a period of more than 20 days, I think they may become dependent on smoking, nicotine. Alcohol, same day. But unfortunately, there are designer drugs or opioids, opium derivatives. I think if you continuously take for 4 to 5 days, finished. The physical dependence will make you to get hooked to that particular drug, and it's a little difficult. And that may lead to poor self-esteem. Educational challenges. All these days, I think they were on rote memory, and now they have to really read the medical curriculum, and we have competence-based curriculum. A lot of abstract abilities have to be inculcated here. And I think it is a little difficult. Now, imagine an individual is absent for 1 or 2 days. It is very difficult for him to really cope up at the time of examination. Extracurricular activity is a must. But unfortunately, extremism in anything is dangerous. And health-related problems, consciousness about the body, that may result either in eating disorder, anorexia, or bulimia. And psychological problems, 50% of the psychological problems, they have their inauguration during adolescence. And 1/3 of adolescent suicides triggered by depression. And poor academics and low IQ can demotivate them. And social problems, this is the period they get attracted towards opposite sex. Unfortunately, they're not able to take any kind of a decision. They may be equated with the Cleopatra who used to tell about the decision with Julius Caesar, salad days. They're not able to really take a particular decision with the opposite sex. And often there is a kind of a role confusion. And sexual feelings may bring guilt feelings. And interacting in social media, that is also another problem to be worried. And sexual health, they experiment with their bodies, may become sexually active, unwanted pregnancies, and unprotected sex. This is also not uncommon. Addiction to cyberspace. Last 30 years of the technological revolution, people started thinking that they become independent. They can outsource anything and everything, right from groceries, food, movies, on OTT, and they start harboring an idea that they become extremely independent, but unfortunately it is not so. Stephen Covey, as the cognitive scientist, used to say, man is neither dependent nor independent, he is interdependent. No point in having 1,250 followers in Facebook or Instagram. Please remember, life exists only in offline. The challenges in the college, this is the best year in your life. Second, even a positive change is stressful. There is certainly a pedestal level in the academic milieu. You have come to this medical profession, and definitely it's a positive life event. That is also a little stressful. Then there is greater academic demands. You have to take a decision on your work. This is an untested water. You have to go with the academic curriculum. You have to go with the peer group. You have to go with your teachers, advisors, and suggestions. Time is unstructured. You have to decide. And you are placed in a new milieu. Nobody is there to control. You are in the hostel. And you have to have adequate, appropriate sleep, eat at proper intervals, adequately you must take rest, and focus on your academic curriculum. And there is a change, perceptible change in the family relationship. Vastness of academic curriculum, there's an important stress factor. Second, fear of failure. We always live for the sake of seeking attention from other people. We always live and lead our life for the scripts written by others. No way at all. This is your life. Don't worry about failures. Failure is the best teacher. Don't worry about failure from the perspective of the other people. And don't worry about poor performance in the examination. If a question is tough, if you are not able to answer either in your NEET exam or in your internal assessment or in the university examination, it's going to be tough for most of the people. And lack of recreation, this is another factor. Recently, I think in Ahmedabad, I think it's cardiothoracic surgeon working for 14 hours at the age of 41 who conducted 16,000 surgeries. He succumbed to myocardial infarction without any kind of habits, without any risk factor. Look after your physical health. Look after your emotional health. 91%, 73 to 91% of medical students, they have moderate to higher level of stress. So relax yourself. This is because of the curriculum, frequency of examination, and competition with their peer. Never compare yourself with others' performance. Compare with your previous performance and try to go for improvisation and worry about future. When you think about the past, invariably you'll be thinking about the negative event and you will become depressed. When you think about future, invariably you become anxious. Be in tandem with the present event happenings and start living for the present. Another pandemic or epidemic is going to really affect most of us is loneliness. In spite of having everything, I think we remain like isolated islands in the family. The real communication is not existing in the family. Only at the time of lunch or dinner or the dinner table, we family members, we assemble. Something like the isolated islands try to unite to form a kind of an archipelago. The virtual communication is not at all happening in the family. And relation with opposite sex, that's also conflicting. And some of the hostels in the medical colleges, people complained about food. Suicide deaths among medical students, residents, and physicians in India, 2010 to 2019. 7 out of 10 suicides before 30 years. Younger female residents and physicians, more in South India and state Kerala. Reason? There are humpty number of people committing suicide. What about medical students? If you ask Pekel, R.E. Kendall, authorities in depression, they may be saying that there are 30 to 40 types of depression. But in simple sense, there are 2 types of depression. One, reactive depression, that is occurring in relation to a psychosocial factor. Second depression is an endogenous depression, which is silent, something like a snake in the grass. And imagine if that particular depression is present in a medical college student. I think one, the good prognostic factor, the intelligence or the exposure, the milieu, they are all protecting. It is very difficult to really, pick up the premonitory symptoms of depression unless otherwise the individual is really mingling with the classmates or the hostel roommates. So it is very difficult. Suddenly, we come to know that a person, a medical student, a girl or a boy, I think, probably committed the act of terminal exit. And we start really analyzing in a retrospective way and used to conduct psychological autopsy. Try to mingle with the people. Try to have meaningful relationships. Try to communicate. I'm not saying that you should have number of friends. No, even if you have 4 or 5 friends, let them be meaningful friends. And 24% of medical students, they have mental health problems. Who is normal? We are all relatively normal or relatively abnormal. Don't worry about it. If the court asks somebody to certify, we invariably certify as follows. This particular individual is not exhibiting any abnormal psychiatric manifestations. We psychiatrists, we never certify that this particular individual is normal because normality is not our cup of tea. Normality, I think we have not seen who is normal. I'm not normal. We are relatively. I'm able to be in tandem with the social expectation. I'm considered as normal. So even if you have anxiety or depression, which has crossed the limit, don't worry. Consult your friend. Can seek help in the respective department. Every hour a student commits suicide. And National Mental Health Survey in 2015 to 16, I think it revealed one shocking finding. 18 to 29 years, any substance abuse is present to the extent of 13.54%. And alcohol use, 2.95. Maybe for the initial stages, you may be drinking as a social drinker, but the trend is little changing. Now, girls are also drinking. I'm not talking like a male chauvinist, but please remember the transition from the social drinking to codependence is very rapid in case of a female, and invariably they present either affective symptoms that drives them to go for alcohol behavior, or with alcohol they go for secondary affective symptoms. And this is probably ending in the terminal exit. What are the mental problems? Adjustment issues. We have conflict, we have stress in the academic milieu, but unable to adjust with the roommate, unable to adjust with the classmates. We are not feeling really comfortable in the class. Second, anxiety. Remember, anxiety, keep it in a measurable level. Depression. If it is crossing the limit beyond dysphoria, seek help from the respective department. Keep away from the substance because the designer drugs that are available now, I think, very, very difficult to come out. An academic problem, let me tell you very frankly, perseveration, hard work is more than enough. I don't think there is any kind of intelligence needed to really pass or excel in medical college. And work-related stress. If you're going to have stress, it is probably going to be experienced by most of the people. And marriage problem, I think, don't worry about it. Don't take any kind of a decision about your marriage because this is a tender age. I think finish your house agency, CRI period, become financially independent and become emotionally independent, then decide about your marriage. What are the stress management techniques? One, especially at the time of facing any conflicting situation, make a genuine eye contact. Be assertive, talk in a very firm voice. That will really fire up all the cylinders. That will really escalate your self-esteem. Second, when you have anxiety because of a stressful issue, the anxiety may reflect on your body as well as the mind. So try to relax the body part by part, like depicted here. No, first I think relax the foot muscle, then leg, thigh, abdomen, upper arms, back, shoulders, chest. At a point of time, I think the total muscles from the head to foot area, I think they're totally relaxed. Feel that relaxation. Close your eyes and enjoy the relaxation. It will have impact on the psychological anxiety, and there is a possibility of coming out of this anxiety. Psychotherapy. Psychotherapy is nothing but a therapeutic communication existing between an individual who is in need of a solution for his problem. And the therapist is not really enforcing his ideas. He is just a facilitator. He is making all the things, all the options open, and he is asking the person to choose the best possible option tailored to his needs. And third, cognitive behavior therapy. Thoughts, they really know they have relationship with feelings, and feelings, they have relationship with behavior. Imagine a conflicting situation, a failure in the probably of failure in the exam. Automatically, you are developing a negative thought. The automatic negative thought is resulting in unwanted emotions. The unwanted emotions are probably not properly processed in the cognitive realm of the individual, and that is resulting in psychological disequilibrium. In cognitive behavior therapy, what we do, ask the person to revisit the particular stressful issue. You failed in the exam. What really happened? Sir, 2 essays and 7 short notes. Then what happened? I missed 1 essay and 2 short notes. Ask him to revisit the situation. Ask him to really analyze the situation. Then ask him to really focus on the other possible thoughts. Let him have other possible thoughts. Let the other possible thought substitute the originally automatically occurred negative thought. So it's easier to really, alleviate the unwanted emotions. And it's possible for the individual to retrieve the previous psychological equilibrium. This is a wonderful technique, non-pharmacological management for stress-related issues. Another one is a deep breathing exercise. This also you try, especially at the time of examination. Before receiving the question paper, before writing a NEET exam, before facing a stress-prone situation, you become anxious. Count 1 to 5. 1, 2, 3, 4, 5. Breathing. Then 6, 7, 8, 9, 10. Hold your breathing. Then 11, 12, 13, 14, 15. Breathe out. I repeat. 1, 2, 3, 5. Breathe in. And 6, 7, 8, 9, 10. Hold your breathing. And 11, 12, 13, 14, 15. Breathe out. It is a very simple exercise. It is not yoga. What exactly is happening at the time of facing a conflict? The autonomic nervous system, the sympathetic mode is going for a hegemonious level. And that's the reason we have increased heart rate, increased pulse rate, excessive sweating, and psychological anxiety is also there. You are reverting by doing this breathing exercise. You are reverting to parasympathetic mode, and you are going to be in an extremely relaxed level. And you will be like a settled batsman in the 10th over who could see the cricket ball, something like a football, and who could smash the ball all over the ground for 4s and 6s. And time management. This is also another part and parcel of stress management. If you want to know the value of 1 year, ask the student who had failed in the exam. To know about the significance of 1 month, inquire the lady who had a premature labor. To know about the value of 1 day, inquire the long distance couple who are separated and used to communicate in the fag end of the evening. The importance of 1 minute that should be understood from the perspective of a person who missed a train or a bus or a flight. The significance of 1 second encouraged the person who had been saved from the accident. The real value of millisecond, that should be understood from the perspective of the person who had come second in the Olympic race. Be a visionary like Napoleon. Napoleon, no, is very famous for writing love letters, especially from the battlefield. In the battlefield, he was really sleeping. And suddenly, he was woken up by the southern end of the southern and commander-in-chief with the bad news that enemies were probably invading. Without changing his posture, without opening his eyes, he asked that particular soldier to search for map number 34 and asked him to follow the instructions. The instructions were followed. Enemies were thrown out. And I was really surprised how come in the spur of the moment Napoleon was able to take this particular decision. No way at all. Napoleon anticipated this problem 2 weeks before the battle, and he formulated planning map for southern, northern, eastern, western. So better plan for all your activities, all your academic activities. There is a 6P formula. Proper prayer planning prevents poor performance. You are preparing for NEET PG. Imagine you are really calculating that it will be consuming 100 hours to complete the subject of general medicine. And if you start reading, only very few people would be in a position to complete within 100 hours. Instead, you allot 10 hours for planning. And in that 10 hours, I think you really subdivide. I'm going to allot more time for neurology. I'm going to allot 2 hours for therapeutics or definitions or investigations. And if you take 10 hours for planning for other remaining 90 hours, most of us would be in a position to complete and compete for NEET PG exam. And type of planning, there is something called operational planning. That means how things need to happen. Every day, day-to-day happenings, I think, focus on this. There is something called strategic planning, why things need to happen. Long-term decisions. I'm going to settle in this place. I'm going to write FMG. I'm going to settle in UK. I'm going to write IELTS. I'm going to settle in Australia. Or tactical planning. What is going to happen? Short-term plans. This kind of thinking. And contingency plans. Suddenly, you must have plan B. Some unexpected things may happen. Or you may be faced with a Hobson choice or a complicated situation. For that, I think you must be in a position to go for plan B, or if plan B is not successful, you must be in a position to accept the consequences. Vilfredo Pareto was an Italian economist, and he was really observing the shopping behavior in a shopping mall, in a particular shop. People are buying, and there is a pattern. Some products are repeatedly bought, and those products were responsible for 20% of the sales, and they were responsible for 80% of the sales or gains. He analyzed, extrapolated, applied in time concept, and he found that we have many work schedules to do, but unfortunately, we are not able to decide which one to choose first. So identify the 20% of the vital few. Start doing, start completing, then you will have 80% of the gratification. This is the Pareto principle. And Dwight Eisenhower is an American soldier and subsequently became American president, if I'm right, in 1961. He identified two variables. As far as the work schedules are concerned, there are two variables. One is an important variable, second is an urgent work. If you are doing an important work, you are going to be benefited. If you are taking an urgent work, I think you are not going to be benefited, but somebody else is going to be benefited. It may be your spouse, it may be your son, it may be your colleague or your boss, and so on. So he combined these two variables and formulated 4 quadrants. Important and urgent, quadrant 1. And important but not urgent, quadrant 2. Quadrant 3, not important but urgent. Quadrant 4, not important and not urgent. Will you be in a position to answer which quadrant you'll choose first? Anybody from the audience? Can I have the answer?
Quadrant 1, sir.
Your name, please.
Nishadan, sir.
Right. Second, any other answer? Hello? Any other answer? Right. Quadrant 1, important work. Yes, you're definitely, you're going to be benefited, but at the same time, it is involving other individuals. Something goes wrong, you'll be taken to task. So go to quadrant 2. It is important. You are going to be benefited. If something goes wrong, I think you can accept, but nobody else is involved. Finish that quadrant 2. Then come back to quadrant 1 and plan for it. Quadrant 3, better delegate to somebody. Quadrant 4, it is not our cup of tea. Then there is another way of really, choosing A, B, C, D, E. The most important task, start finishing it. Second, because by doing it, by not doing it, you'll have consequences. You'll have major consequences. Second, B work, B type of work. By doing this or not doing this, you'll have minor consequences. Second, start completing B-related work. C, something like now, quite often we used to check our email. We used to check our probably, Instagram and Facebook. C. D, delegate. E, eliminate. How to deal with overwork. Understand the pressure. Never become anxious. And at the time of really, getting in a kind of an option choice, we will start blaming other people, or else we'll start really, directing aggression towards ourselves and we'll be blaming ourselves. Never do that. Have some kindness. Walk away, estimate the time as well as possibility, then agree priorities and keep them. Remind you about the limited time. I'm not able to read faster. Quite often, we used to get complaints from the students. Remember, a water is flowing in a river with a volume of 1 lakh, and it's flowing with the speed of 10 kilometers per hour. At any given point of time, at any given point of place, it could accommodate 10 kilogram of water. If you increase the volume from 1 lakh to 2 lakhs, yes, at any given point of time, I think it could accommodate, would become double, 20 kgs. Instead of doubling the volume, double the speed. From 10 kilometers per hour, you increase the speed to 20 kilometers. Then at any given point of time, place, it could accommodate, that would become 64 times. So speed is the key. Try to read faster, 500 to 1,000 words per minute. Some of the legal luminaries in the Supreme Court and some of the politicians in Tamil Nadu of yesteryears, both opposition and the ruling, I think they were very good in reading at a faster level. So if you develop in the initial stage, I think you may have some teaching problem, but once you really meticulously, you practice it, it's easier to really read 500 words per minute and you can really, read it. And resilience. This is a quality one should really possess. Resilience is nothing but adaptability in adverse situations. It is an ability to focus on solutions rather than getting stagnated with the problems. It is not merely bouncing back, but every time when you're getting up, I think you're getting up with the personal and professional development. It's something like climbing a mountain without a trail map. Martin Seligman, who gave a beautiful concept called learned helplessness at the time of facing a conflicting situation. He said, there are 3 P's to be avoided, especially at the time of facing a stressful situation. Personalization. Don't think this is the problem only me, I think I am facing, nobody else. Never consider it as a personal problem. Second, pervasiveness. This is going to affect all the facets of my life. Third, permanent. This is going to last forever. Avoid these 3 P's. Signs of resilience. 1, start thinking that you have survived the situation even before surviving, because that will be giving a kind of a self-esteem. You will escalate your self-esteem and you'll start firing all the cylinders. And you may be in a position to regulate your emotions. Emotional cohesion will be better. Emotional quotient is nothing but understanding your emotions, understanding others' emotions, understanding the interaction between your emotions and others' emotions, and trying to get the best beneficial effect. And that will probably, pave way for identifying problem-solving skills. And self-compassion should be there. You must be very kind to yourself and seek help from your friend or relative or dear and near. There are 7 C's needed for resilience. One, competence. You must have set of abilities. I think life is a kind of an experience, and especially at the time of failure, try to learn something and see that you have that ability. Second, confidence. Ability to use the set of qualities, that is confidence. Third, connectedness. You must be in tandem relationship with the family, with the social milieu, with the friends, with the near and dear. Four, character. It is a fundamental principle of an individual. Fifth, contribution. It is a motivating factor. I think you should have some self-talk. I think I'll face it. There will be a solution. If not, I'll accept it. That kind of a motivating aspect should be there. And coping or dealing with the stress. Last, control. You are trying to see inner self. You are going to indulge in introspection. Intelligence is just a variable. Never think that people are really intelligent. It is an innate quality. No, it can be developed. And remember, hard work plus perseveration is better than intelligence. Let me give an example. Sir Francis Galton, he gave a beautiful concept about eugenics, behavioral genetics, and being machine. He's the cousin of Charles Darwin. And he was, Francis Galton was considered to be a child prodigy. But Charles Darwin was an ordinary person. In his own words, I think I had average intelligence, but he was chasing his passion. He had probably on a voyage. He had a lot of researches on fossils. He was really, chasing his passion, and probably came with a beautiful concept, origin of species. So it is not intelligent. It is the hard work and perseveration and the ability to identify and chase your passion. That is more important. Failure is just a data. Remember, I think if you inquire all the people who are victorious in the pedestal level in the academic milieu, I think without facing failure, they would not have come to that place. With humor, you can see the forest through the trees. Try to have some humorous nature. What exactly is happening? At the time of facing a conflict, we try to think that there is one particular solution for this kind of a problem. It's something like a camera on a tripod which can capture one particular image. Remember a drone camera or a camera on a trolley which can really capture multiple images. If you have humorous nature, you may be in a position to really see and visualize and understand the problem from others' perspectives. And that would be really helping you to go for other possible solutions. Technology provides what we want, but not what we need. So, dependent on technological aspects is slightly inferior to dependent on meaningful relationships. Please remember, life exists in offline only. Don't be satisfied with 1,250 followers in Facebook or Instagram. Communicate with your parents. Develop the habit of talking to your parents, talking to your friends, and every day, try to have some kind of empathy with other people. Extracurricular activities, they reduce the stress level, facilitates friendship, prevents social anxiety, and there is something called we not only learn from our own experiences, from others' experiences also, and here comes our companionship. Try to be a little proactive rather than reactive. Proactive, especially dealing with the competence-based academic curriculum. You are ahead of schedule and minimal pending task list. You are perceived as star, peace of mind. See, only at the time of examination, just before 5 days or 1 week before the exam, I am going to prepare. You are behind the schedule, long pending task list is there, perceived as failure, and it is very difficult to cope up with the present curriculum. Focus on the future. Never go for instant gratification. Dr. Edward Banford of Harvard University, after 50 years of research, identified one simple factor called long-time perspective, the most single accurate predictor for upward and social mobility. That's more important than family background, education, intelligence, race, and other factors. Types of time. One is a fast time, absorbed or enjoying in an activity. Remember, you have a boyfriend or a girlfriend vibrating in the same frequency, even if you talk for more than 5 hours, it will be perceived as if you are talking for a few minutes or few seconds. If you are not interested, if something is boring, I think that is perceived as slow time. And remember, based on circadian rhythm, how to really utilize the task. Cognitive task, morning 8 to 12 noon. Your first time you are reading. You want to really keep everything in short-term memory. Or whatever you read, whatever you kept in short-term memory, that has to be converted into long-term memory. Go for this particular period. Then short-term memory, 6 to 10 a.m. Long-term memory, already you are familiar with this topic, 1 to 4 p.m. Manual dexterity, 2 to 6 p.m. I don't have time to read because I'm very busy. I'm tired. Quite often we complain. Albert Einstein lost his wife. His sister moved his residence and she was staying with Albert Einstein. Something unfortunate happened and she probably slipped into coma and she was bedridden. Absolutely, she was like a vegetable. In spite of the busy schedule, research schedule, Albert Einstein used to come by 1 o'clock daily. And between 1 p.m. and 2 p.m., he used to read Plato's Republic with the faint hope that it would stimulate the brain of his sister. Whether it is a scientific basis is there or not, that's a different issue. And he used to do it every day. Albert Einstein, in spite of his busy schedule, was able to really allot 1 hour for the ailing sister. Why not we? I think we should plan in such a way that we should allot some time for our recreation, our academics, and other sleep. There is a beautiful principle called flow. Mihai Csikszentmihalyi, American-Hungarian psychologist, he gave this particular concept. When you're watching a particular movie in a cinema theater with a buttered popcorn, what exactly is happening is a flow. You're totally involved. Or when you're worshiping God in the sanctum sanctorum, what is happening, what is transpired is flow. When somebody is having an interaction with another female or a male is vibrating the same frequency, or when somebody is trying to have sex, there is a kind of a dissociation. Unless until you have dissociation, I think it will not be perceived as a healthy sex. What is happening there? It's flow. Flow is nothing but totally involved, totally immersed in a particular activity. The டீ கடையில் அப்படி ஆற்றுவாங்கல்ல, அது ஒரு அல்லது ஒரு பரோட்டா கடையில் அப்படி கொஞ்சம் போட்டு அப்படி விசிறி அடிக்கிறது, அல்லது நாத்து நடும்பொழுது, totally involved. When you are able to really perform at an optimal level, considering your anxiety, considering the workload, you're beautifully, you are very comfortable with that particular work because you are totally involved. When you practice flow, they are known as autotelic people. They will not be seeking any kind of recognition or certificates from other people. At one point of time, they will not be worrying about the consequences, whether this is going to provide beneficial effect or end in some disaster. They will be interested in doing the work. If others are doing the work for reward, for them, work itself is a reward. Practice this principle flow, especially in the academics. You start enjoying. In Tamil, they used to say, கஷ்டப்பட்டு படிக்காதீங்க, இஷ்டப்பட்டு படிங்க. I think you will remember so much. Points to ponder. Eat well. Sleep well. Be proactive. Be ahead of the schedule. Socialize. Never be a solitary reaper. Play. Have some extracurricular activities. But extremism or anything is dangerous. Never compare with others. This is your life. Accept your status. I'm from an ordinary family. I'm from a lower socio-economic background. I'm from a middle class. My father is an illiterate. My mother is an illiterate. Nothing wrong in accepting. I think never seek any recognition or certificates from other people. Don't blame yourself, especially at the time of failures. Learn to say no, especially at the time of probably, experimenting, or somebody is, trying to really, compel you to take some drugs. Never. No confusions with the relationship with opposite sex. Be in touch with the parents, talk to them daily, be in touch with your friends, be in touch with your passions. Have a positive outlook. So, in the concluding session, I would like to say there are problems, there are stressful issues. For that, you have solutions. Some problems, there are no solutions. We have to accept, live, do not merely exist. I would like to conclude a beautiful Tamil song, Kannadasan. உனக்கும் கீழே உள்ளவர் கோடி நினைத்து பார்த்து நிம்மதி தேடும் ஆற்றங்கரை மேட்டினிலே ஆடி வரும் தென்றலது ஆடி இருக்கும் தென்னை மரம் காற்றடித்து அது விழுந்துடும். ஆனா நாணல் காற்றடித்தால் சாய்வதில்லை என வளைஞ்சு கொடுக்கும். கனிந்த மனம் வீழ்வதில்லை. Be flexible. Face, live, accept. Thank you very much.
Thank you so much, sir, for your valuable time. It was a great opportunity to hear from you the various aspects of stress management and the exercises that you suggested us to fight against, situations of anxiety and other social situations. And it would really help the lives of multiple and every other medical and non-medical students in managing their life and stress. So thank you so much, sir, for your valuable time.
Any questions?
We'll check for the questions in the comment box. No, sir. Until now, there has not been any questions posted, sir. Thank you,
Right,
sir.
right.
Thank you so much for your time, sir.